Today is May 28th, 2024. A recent systematic review from the Department of Dental Medicine at Victor Babes University in Romania has explored the efficacy and safety of botulinum toxin type A, Botox, in treating temporomandibular joint symptoms associated with sleep bruxism, or teeth grinding. The review analyzed 9 randomized clinical trials involving 137 participants. Findings suggest that Botox significantly reduces pain, improves jaw function, and decreases the frequency of bruxism episodes. For example, one study showed a reduction in mean pain scores from 7.1 to 0.2 over 6 months to a year post-treatment. Another demonstrated a decrease in bruxism events from 4.97 per hour to 1.70 per hour in those treated with Botox. Adverse effects were generally mild and transient, including injection site pain and minor cosmetic changes. These results highlight the potential benefits of Botox in managing sleep bruxism and temporomandibular joint disorders. While promising, more extensive studies with consistent methodologies are needed for conclusive evidence.